Good afternoon and welcome to the information session for the Temple College Dental Hygiene Program. I'm Melissa Mahalik. I'm the Program Director here at Temple College. I'm going to go through a few slides here for you all to find out a little bit more about what is a dental hygienist and what does our program consist of. So what is a dental hygienist and what do they do? We are a licensed dental professional. We are the only other licensed professional in the office other than the dentist. We are the prevention experts of the dental team. That's our primary job, is to prevent oral disease. It's to educate patients on how to prevent those diseases. We remove the hard and soft deposits on the teeth that are causing the gingival and bone disease of the mouth, otherwise known as periodontal disease or gum disease. We can apply fluoride applications, sealants, and take x-rays, dental x-rays. We can provide nutritional and tobacco cessation counseling. And then we are the educators in the community primarily. We are the ones that you typically will see coming into schools, assisted living, just a lot of different areas, educating the community on oral health. Where are dental hygienists employed? Primarily, this little chart over here, it was from one of our dental hygiene magazines from December 2019. About 85% work in a clinical setting, in other words, chair side. Also, the other 10% that's kind of in that same mode is they work in the corporate dentistry, so they may not work chair side, but they still work in a dental office or for possibly a corporation. And then there's about a 5% unsure. Other areas that someone may work with advanced education, typically a bachelor's degree or higher, would be in education, community dental hygiene, maybe for the state, something like that. Management and consultant positions, supply representatives such as like Crest or Colgate, Sensodyne, either a representative or a salesperson there. And then with advanced degrees, possibly in research in a hospital type setting. Also, this little chart shows full-time versus part-time breakdown. Those in corporate dentistry is about 85% full-time, whereas in private practice is about 64% full-time. So you can see that there's a little flexibility there. This slide shows, this is actually from also that same magazine in 2019, the average full-time pay, and again you need to read into this full-time pay, meaning 40 hours a week, by state. And you can see that Texas falls right here within the 60 to 69,000 a year for full-time pay. Now, so many of the, if you think back to that previous slide, I'm going to go back one. When you look here, 36% of private practice clinicians work part-time. So when we look at these numbers, make sure you have that in mind, that this is full-time pay by state. We're kind of right in the middle. We're not on the high end. California and Alaska are your high-end states, and then we do fall relatively right in the middle. As you can see, is primarily most of the country. If you would say 50 to 69,000 a year, that's a good range. We do require students to meet certain essential technical standards and qualifications. And this is just a snippet of what we do require. Once you're in the program, we send out something to you a little bit more comprehensive that you will have to attest that you are able to do. First thing here I have noted is enjoy working with people. You need effective verbal and nonverbal communication. You need to always have no discrimination on your treatment. You can't say, I don't want to see so-and-so, I'm not treating so-and-so. It's just like when you make an appointment to go to the doctor's not going to say, I can't see you. So you've got to be able and willing to work without discrimination. You have to have good psychomotor skills, including critical thinking and reading comprehension, and then application. In other words, you learn the material in the classroom and you have to apply it clinically. So someone that can retain information, memorize, make good grades on every exam, but can't apply it clinically in the mouth is not a good candidate. So you've got to be able to apply what you've learned. We want you to have good vision, so visual acuity is important. You are looking in a little dark hole at tiny objects and tiny things in the mouth. So we need good vision. It can be assisted vision with glasses or contacts, but you need to be able to see. You need to have good interpersonal ability to display good judgment and function under stressful conditions. Not only here in school, but in private practice. There's a lot of pressure as far as time management, seeing people on schedule, on time, and those types of things. So very important. If we continue on, we also want good auditory abilities. An example would be listening to a stethoscope and hearing the blood pressure. Of course, you want to be able to hear and understand your patients. So you have to have good auditory abilities. Good motor skills, gross motor and fine motor skills, including balance, hand-eye coordination, finger movements, wrist rotations, fine motor skills in both of your hands, because you are utilizing both hands simultaneously while working at the chair. One hand is a mirror hand, your non-dominant, and your dominant hand is your working hand. So you are utilizing both hands at one time. We have finger pad sensation and good tactile sense here, meaning that anything below the gingival or gum line margin, you have to do by feel. You have to be able to feel on the pads of your fingers. We do a lot of our work by feel and touch. So good sensation on the finger pads. Sometimes someone that's had major injuries to their hands, nerves cut, burns, things like that, if they've lost that tactile sense, they would not be a good candidate for dental hygiene school. We also, this kind of sounds silly about physical endurance, but it's physical in a different manner. It's not like running a marathon, that type of thing, but being able to sit for long periods of time. You use repetitive movements. You need good upper body strength sitting at the chair and sitting properly without damaging any sort of, we call it our ergonomics. We teach you where to sit at the chair to access certain parts of the mouth in the right way, so that you're not putting stress on body parts such as hands, wrists, forearms, your back. If you're twisting and trying to manipulate and see something, we teach you how to use that mirror, and you need to be using that mirror, not trying to see directly. But a lot of hygienists will have fatigue from just the way they have to sit at the chair and how they're working, and their ergonomics is not what it needs to be. And then also completing tasks in a timely fashion. Like I said earlier, you need to be able to stay on schedule and stay on task. Our program here at Temple College is accredited by the Commission on Dental Associations Commission. Our last one was in 2018, and it's every 7 years. This time it's going to be 8 years. The reaccreditations were postponed due to COVID, so we've gained a year. So instead of 7 years, it will be 8 this time. So 2026 is when we will have the site visitors here at our school again. We were accredited with no recommendations, so we are meeting all the standards and educating our students accordingly. Students that get into the program will graduate with an Associate's of Applied Science degree. We take 12 students each spring into the program. We are limited on admissions due to the number of chairs we have in the clinic. We have 12 chairs. And some of those standards from the CODA, we need to have, every student in the program needs to have equal opportunity and equal amount of time chair side. And by limiting the number of students, everyone has an opportunity and has the same amount of time to complete their tasks. We also have very strong national and regional board exam scores. So how do you apply to our program? First thing is you're listening to this information session. It's online right now. We have had them in person in the past, and I'm not sure that we'll go back to those, but attending this one online is the first step. You also need to apply to Temple College. You need to send an official transcript to the Admissions and Records Department of the college, as well as an official transcript to our department chair. Not chair, but our department. And my secretary or administrative assistant is Miss Rosemary Laws, and you can send it to her attention. So one to the college, Admissions and Records, and one to Temple College Dental Hygiene Department, attention Mrs. Laws. And her information I'll have at the end of this, as well it is on the web page. You have to have, before you're ever even considered for the program, you must have completed microbiology, chemistry, anatomy and physiology 1 and 2. And those courses cannot be over 5 years old. They have to be taken within the past 5 years. Our deadline, application deadline, is the second Friday in February by noon. And so this year, I believe it falls on the 11th, February the 11th. Don't quote me on that, but I'm pretty sure. So the second Friday in February of each year by noon. The college closes at noon on Fridays. So those applications have to be in our hands no later than that time. We do have a drop box out by our clinic door that you're welcome to put applications in. If you live locally or close, that you can actually drop it off here instead of sending it in the mail. When we get ready to look at everybody's applications, we look that they have a high school, they're a high school graduate, or they have their GED or equivalent, the Texas Certificate of High School Equivalency. You must have a GPA of 2.5 or higher. All, like I said, the prereq science courses must be completed, and these grades are significant. More significant than core courses, but they all are significant. So the higher the grades in these courses, the more likely you will make it into the top 24. I said official transcripts. Those need to come from any and all colleges you've attended in the past. Even if it was for one semester, we need all official transcripts sent in. That would be one to Admissions and Records, one to our department. So you need 2 copies of everything. You must also take a standardized test. This is a standard in our accrediting bodies standards, and you can take it at any college testing centers that actually administer the APPLICANTS. Not all programs want the same standardized test. Some want different ones. Nursing here wants a different one. And our testing center does handle all of those. You could take it here in Temple or in Hutto if you want to take it at Temple College. And at both of those sites, those can be sent directly to Mrs. Laws via in-house secure email, but you must let the testing department know that this is for dental hygiene, and then you need your results sent to the dental hygiene department here at Temple College. This is a little new if you have applied before. In the past, we had wanted you to take the TEAS exam between July and February the 15th-ish. This year there have been some changes made to the TEAS exam, and those changes will not be initiated until October of 2021. So your time frame to take the TEAS for this year's application period is October 1st through February the 10th. So if you've taken it before October 1st, it will not count. So in order for us to look at it and everybody to be on the same playing field, it needs to have been taken between October of 2021 and February 10th of 2022. You must have at least a 60 composite score. Now, when we talk about a composite score, that's the, why is this advancing? I'm sorry. It's advancing on its own, and I apologize for that. I want to still talk a little bit about the TEAS here. You can take the TEAS up to 2 times within that time frame. So you want to take it early on, October, November. If you don't do well enough, you feel you could do better, you have a little time to study and then take it again early 2022. Like I said earlier, you have to have at least a 60 composite score. But in the past few years, to be a competitive applicant, you want to be in the 80s or higher. So if you don't like what you scored the first round out, you might want to study a little harder, get the study guide for the TEAS, look at what you missed prior, and retake it and hopefully score higher. We will take the highest score that you submit to us. So if you submit one and then you retake it and it's higher, we will change that and accept the higher score of the 2 that you take. So here's a little about TEAS. You do want to get the study guide. Don't wait till the last minute to take the exam. And I have to reiterate, these scores are good for 1 year only. You must retake it each year that you apply. If you applied last year, you must retake it between October and February. If it was 2 years ago, those scores do not stay because we're basing it on a year-to-year basis so that everybody is on an equal playing field. So get the study guide, review it, and if you take it once and don't do well enough, study some more, see what areas you missed the most in, and try to retake it. We are going back to requiring observation time. We put that on hold during COVID, but we have had many students able to go in and observe now. So you will be required 16 hours of observation, with primarily the majority of it with the dental hygienist in the office, not the dentist. You must go to 2 separate dental settings. You cannot do all 16 hours at one place. We want you to see a variety, at least 2 minimum different offices. You can go to more than 2. You can do 4 hours at 4 different dental practices. But we want you primarily watching and observing the hygienist. If you are in the dental office and you have some dental experience, you can use the employer observation, but you also need to do an additional, it cannot be all 16 hours there. It needs to be split up. So you'll need to go out and at least observe in 1 additional office, if not more. Those forms are on the website and they're in the information packet you can download off our webpage. To increase your application points, the more co-requisites you have taken, the better your chances. So we require speech, sociology, fine arts, psychology, and English composition 1. If you have all of those completed, you will get more points added to your application. So you don't have to have them all completed, and it's still a possibility to get into the program without having them all completed, but you have a better chance if they are all completed prior to the application due date. So they would have to be, for this year, applying for the class of 2022 period, you would have to have completed these courses by the end of December 2021. Let me go back. This might be a question in your head right now too. Now, the 4 science prereqs have to be taken within the last 5 years. Your co-recs, that does not apply. They could have been from 10 years ago. If you like your grade in those courses, then it's perfectly fine to submit those. They do not have to be current or within the past 5 years. We also offer a dual enrollment to acquire your bachelor's in dental hygiene at the same time as getting your associate's in dental hygiene here at Temple College. You can get your bachelor's degree through Texas Women's University. There is, if you look, I think it's called University Partners on our webpage. You click there and it will bring you to this link down here, and it will take you directly to the Texas Women's University's site that shows how we work together with them in order for you to graduate with your bachelor's degree. Basically, it's very possible you could get that degree a week before you get your AAS. So some additional courses if you're needing to fill a semester due to financial aid or whatever. Other courses that they will require prior to some of their courses that you can take would be statistics, just entry-level statistics, Comp 2, and then U.S. federal government. So we'll talk more about that once you are in the program, but if you wanted to go check it out, you could click on the link on our webpage, and that would take you there and you could kind of look at it. All of the courses with TWU would be totally online. You don't even have to ever go to TWU unless you want to go walk for graduation. So it's very easy to do. We currently have some students enrolled in that. We have every year for the past 5 or 6 years. I've kind of lost track of when we started this, but it's a really great opportunity. It's cheaper than completing your bachelor's once you complete your education here at Temple College. And then it gives you a few more job opportunities as far as in other avenues, not chairside. It makes no difference in what you do chairside, and it makes no difference in your pay or anything like that. But it gives you that opportunity to have that degree completed in case you determine in the future you want to go into education, you want to maybe look at the sales representative type employment. There's several other things that you can do with that bachelor's degree in dental hygiene. So it's really important here to apply to Temple College prior to turning in your dental hygiene application. We want you to be, it does not cost you anything to apply here, but once you start sending in your transcripts, you'll be on file here, okay? Also, admissions and records are the people that can, and advising, that can verify the transferability of your previous courses. If they were not taken here, they were taken in another college, these guys would be the ones that would be able to verify, okay, does their chemistry match up with ours? Does their English transfer? Okay, they took stats, is that equal to our stats? These are the people that do that. We can guide you, but we can't determine this as far as in our hygiene department. So the sooner you can apply to Temple College, get your application done, then start sending in your transcripts to see what is transferable. So how we work the applicants is the top 24 applicants will move on. Once the application and all the numbers are worked, and we put you in numerical order, top 24 highest to the lowest. You will have an interview with our selection committee. We will ask for a writing sample that day, as well as have you do a dexterity exercise. Once that is complete, the candidates will all be reassessed as far as scoring from the committee. And those top 12 will be contacted with information that they have been conditionally accepted. And this will happen no later than March the 15th. If you did not make it into the top 24, you may get a letter that states you are on an alternate list. And there's several years we have had to go into our alternate list. So making the alternate list, there's also a chance that you will be in the program. I think I went into my alternate list this year. So it just depends on the year. And usually what happens here is someone has applied to multiple dental hygiene schools and they are accepted into multiple schools. And so then they choose which one they want to attend. It could be as far as like the distance from their home. They don't have to move. There's all sorts of things. They liked one school better than the other, that kind of thing. So if you're on the alternate list, then there is a possibility that you might get an acceptance letter at a later date. If you're not accepted into the program, you may reapply, but you are limited to 3 attempts total. So we keep your files for up to, over time, and you're not allowed to apply more than 3 times. But you do start over with all the information. Of course, your transcripts are here, so you don't have to send those, but you would need to send anything new. This must be on automatic advance. I apologize for that. No, you would not have to resubmit old transcripts, but anything new that you would take in, maybe you increased your score, maybe you had a B or a C in one of your sciences and you think that might move you up a little bit. Anything that you take new and score better, you need to send us those transcripts. Also, maybe you didn't take all your co-recs and you took some more co-recs. You would want to send that in. You would have to do more observation, and you would have to take the T's over. After someone is considered as conditional acceptance, then we ask the applicant for more information. And this is when I know some schools want immunizations up front. We don't until we have selected our class. So these are some of the things. Let's go through real quickly. It's your traditional immunizations, background check, and then there's a more in-depth technical standards and qualifications that you have to attest that you can complete, and the document is signed and sent back to us. So just a little bit more about dental hygiene school. It's very time consuming. You need to treat it like a 8 to 5 job. Even if you don't have class, say one morning out of the week, I would spend that time studying. It's very science heavy. It does require a lot of life and financial planning. We haven't got. We'll get to the cost of the program here in just a minute, but it is a little bit of a financial issue because you are buying extra. It's not just tuition and books anymore. You're buying dental instruments, a kit, your uniforms, many things. You have to pay for boards. So we'll look at that in just a minute. You need to be very organized. It's a lot of material in a short amount of time. And working is strongly discouraged. We know you sometimes do have to work, but we discourage it often. Here is the expenses. You can refer, okay, let's go back. This skipped on me again. Refer to the information packet, download it from our site, and it'll have the cost, and we'll go to that slide. It was the next one, but we'll go to that in just a second. On this one, I also wanted to make sure I have a separate slide here about all the additional licensing fees. These are not Temple College fees. These are fees that have to be paid for in order to acquire your license with the state of Texas. You take a written national board exam, you take a clinical Regional board exam, you take an ethics and jurisprudence exam for the state of Texas, and then you pay licensing fees. So let's look at those real quick. I know this is kind of hard to see, but maybe in front of the computer you can see it better than when I do this face-to-face. Primarily, most students fall in this out-of-district category I have circled here in red. And for the cost of the program for 2 years, it's approximately $21,000. I have over here those things I mentioned on the previous slide, the National Board Review, your board exams, your jurisprudence exams. Those are an additional approximately $2,260 at the beginning of this last spring semester. So I just want to make sure, and if you look on your little sheets when you print it out, we have when these amounts are due. And all of these 4 are early on. The 3, the national board you usually take in March, but you have to sign up for in January and pay. Same with the REB, which is the Western Regional Board. So those are early spring, your final semester. Okay. So look at this carefully. In district would be, of course, it's slightly cheaper. That would be those that live in Temple and pay Temple school taxes. So I know a lot of Temple's city limits go into Belton School District. So if you live in that area, you're out of district. You're not in. It's only if you pay Temple school taxes. And I do want to reiterate here, all costs are approximate, and they're pretty close, okay? We don't just throw numbers out there. That's why we have it kind of listed here for you. And there, of course, this does not include your room and board or anything like that. So just review that in the information packet closely. Also, you need to give serious thought. This is a profession that we work with blood-borne pathogens, and so there is always occupational risk for healthcare workers. In this slide, it says, although the incidence of blood-borne infections is extremely low, it's possible to acquire diseases such as hepatitis B, C, and HIV through exposure. We do require immunizations. And we do provide thorough education on infection control, prevention of infectious disease, and we follow all CDC and OSHA blood-borne pathogen standards, as well as the Texas State Board of Dental Examiners. But this is something I do have to present to you. The next slide here is directly out of our Policies and Procedures Manual on blood-borne pathogens and infectious disease. I'm not going to read this, but I would highly recommend that you all read this, because this comes directly from our state board also. And there's certain instances where a license would maybe not be granted once you've completed dental hygiene school. So please review this and read this in the information packet thoroughly before submitting your application. So I just want to throw this slide up here because a lot of times patients or students or prospective students think this first picture is all we treat, the pretty, beautiful white smile, where in actuality we treat these other 3 slides more often. This is someone with periodontal disease and gingivitis. The gums bleed. That needs to not bother you. Here we have someone that's lost bone around their teeth and their root is exposed, and here the root has buildup on it and inflammation and a little bit of pus maybe around the margins here. And of course, this is a very severe case of periodontal disease. Here's the tooth, but all of this is all calculus or tartar buildup on someone's tooth. So, and that is what we remove. That's what we remove clinically in chairside. And then we see some results. This slide will not turn into this smile, but this person will have pretty teeth again and healthier tissues supporting those teeth once the hygienist has completed her job. We do start our curriculum in the summer. You take 2 courses in the summer. These 2, preventive dental hygiene care and oral anatomy, histology, embryology, head and neck anatomy. Also, we take group CPR sometime in the month of June. We also have 2 days of orientation prior to starting your summer courses, and those typically are on the Tuesday and Wednesday of the 3rd week of May. So submit all your documents early. This is just review, transcripts from every college. You need your observation forms done. You need to take your TEAS scores, and this is where I have, they need to be sealed and stamped and official if you do not take them on a Temple College campus. If they are here, if they're taken on a campus here or in Hutto, they can be sent from the testing center to Mrs. Laws. And also, if you have sent things in or have changes to your application or anything like that, you need to make sure that you get with Mrs. Laws close to that deadline in case something's missing from your application. Just verify. And the best way to contact her is through her email. And I don't even have it on here, but you can find her on the webpage. It's all listed there. You can also go through the templejc.edu webpage, Academics Dental Hygiene, and you can find all of our information there. Here is a picture of our current clinic. We will be renovating and adding on to our health science building with the passage of a bond that was just passed this May. And so this is very likely to change in the future, but it looks very nice. Operatories are large. And I wish I could give you a tour, but we're doing these information sessions now online. So this is your peek into the dental hygiene clinic. So now that you are about finished listening to me go on about our program, you need to complete the certification of attendance in order to get your application for our program. Once you have completed the certification of attendance, it'll be, I think it's 3 questions. It's kind of in a test format. You will receive an email from Mrs. Laws once she is notified that you have completed that certification. And it will come from Mrs. Laws' email address here at the college. I appreciate your time and look forward to meeting you all.